Hello, my name is Christopher and I'm going to introduce the Unit 13. The Overseas Doctors. The Overseas Doctor. Types of registrations to manage and treat patients in the UK. All doctors must register with the General Medical Council. There are several types of registration. Provisional registrations is for doctors who have just qualified from medical school in the UK or from certain European Economic Area member states. Full registration. Full registrant is for doctors who have completed their year's clinical training. Limited registrant is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. Especially registrant is for doctors who have completed specialist medical training and have a certificate of completion of training. The GP register is a register of all those eligible to work in general practice in the NHS. Note: for full details of the General Medical Council, see www.gnc.uk.org. PLAB. Before they can obtain full registrations, some categories of overseas doctors are required to take the Professional and Linguistic Assessment Board test. PLAB is designed to ensure those who pass can practice safely at the level of an CHO in a first appointment in a UK hospital. Part 1 consists of a written test of knowledge, skill, and attitudes. Part 2 is an objective, structured clinical examinations. It consists of 16 5-minute clinical scenarios, now a station to assess professional skill. PLAB station and device and advice. OSCES access this skill. Clinical examinations. Your ability to carry out a physical examination of a simulated patient and actor trained to play this role will be assessed. Uncomfortable or intimate examinations will be carried of using a mannequin and anatomy model. Practical skills. You will be assessed on practical skills such as suturing and giving intravenous injections. Communication skill. Your ability to interact with a simulated patient or in some cases the examiner will be assessed. Skill tests may include breaking bad news and giving advice to lifestyle. History taking. Your ability to take an accurate history and make a reasoned diagnosis will be assessed. Advice on the station for a successful candidate. Read the instructions on site each station carefully. You have 1 minute for this. Don't forget the ABC, airways, patients, and circulations protocol in every emergency station. Keep in mind safety precautions like throwing the sharps in the sharp bin. Check the patient understand what is happening. Then ask them about any concerns they may have. Don't just give a lecture. Listen carefully to what the actor says. Ahora, traduciendo todo eso al español, decimos que el médico extranjero, tipos de registro. Para gestionar y tratar pacientes en el Reino Unido, todos los médicos deben registrarse en el Consejo Médico General. Existen varios tipos de registro. El registro provisional es para médicos que acaban de graduarse de la Escuela de Medicina en el Reino Unido o de ciertos estados miembros del Espacio Económico Europeo. El registro completo es para graduados médicos internacionales que no hayan completado el equivalente a un año de formación clínica en el Reino Unido. El registro de especialista es para médicos que han completado una formación médica especializada y tienen un certificado de finalización de la formación. El registro de GP o GP es un registro de todos aquellos que pueden trabajar en la práctica general en el NHS. Nota: para detalles completos del Consejo Médico General, consulte www.gmc.uk.org. PLAB o PLAB. Antes de que suelan obtener el registro completo, algunas categorías de médicos extranjeros suelen tomar la prueba de la Junta de Evaluaciones Profesionales y Lingüísticas, PLAB o PLAB. Está diseñado para garantizar que aquellos que aprueben puedan practicar de forma segura al nivel de un SHO en una primera cita en un hospital del Reino Unido. La parte 1 consiste en una prueba escrita de conocimientos, habilidades y actitudes. La parte 2 es un examen clínico estructurado objetivo. Consta de 16 escenarios clínicos de 5 minutos, conocidos como estaciones, para evaluar las habilidades profesionales, estaciones PLAB y asesoramiento. Los evalúan estas habilidades. Exploración clínica. Se valorará su capacidad para realizar una exploración física de un paciente simulado. Un actor capacitado para desempeñar este papel se realizarán exámenes incómodos o íntimos utilizando un maniquí, un modelo anatómico. Habilidades prácticas. Se evaluará en habilidades prácticas cómo suturar y administrar inyecciones intravenosas. Habilidades de comunicación. Se evaluará su capacidad para interactuar con un paciente simulado o, en algunos casos, con el examinador. Las habilidades probadas suelen incluir dar malas noticias y dar consejos sobre el estilo de vida. Toma de historial. Se evaluará su capacidad para tomar un historial preciso y hacer un diagnóstico razonado. Consejos sobre las estaciones de un candidato seleccionado. Lea atentamente las instrucciones que se encuentran fuera de cada estación. Tienes un minuto para esto. No olvide las vías respiratorias, respiración, protocolo de circulación en la estación de emergencia. Tenga en cuenta las precauciones de seguridad, como arrojar los objetos punzantes al contenedor de objetos punzantes. Chequear al paciente, comprender lo que está sucediendo. Luego preguntarle sobre cualquier inquietud que puedan tener. No se limite a dar una conferencia. Escuche atentamente lo que dice el actor. Exercise 13.1. What kind of registrant might this doctor obtain? Look at A opposite to help you. A newly qualified Spanish doctor, provisional registration. A newly qualified Nigerian doctor, limited registration. A doctor who has successfully complete the first foundation year, full registration. An SHO who has successfully completed the foundation program and gained a certificate of completion of training after civil specially registered post, specialist registrant. Write the abbreviations in words. Look at A, B, and C opposite to help you. Any doctor who wants to work in the UK must register with the GMC, General Medical Council. Some overseas doctors must pass the PLIB test before they become registered, Professional and Linguistic Assessment Board. Part 2 of the test consists of an OSCE, Objective Structured Clinical Examinations. In any emergency, remember the ABC protocol: airways, breathing, circulation. Before you can be obtained special registrations, you must have a CCT, certificate of completion or completion of training. Complete the test. Look at A, B, and C opposite to help you. My name is Musa, and I come from Yemen. I came to the UK about 2 years ago after graduating because Yemen is outside the EEA. I could only obtain limited registrations with the GMC. At first, it was very difficult for me to obtain a place on a foundation program. Although I speak good English, I had to take the PLAB or PLAB test to show that I could work safely in the UK. If I had to give some advice to other candidates, I would be what a consolidate station. You shouldn't simply memorize a set of phrases. It's better to really think about what you're saying to the actor and get the intonation right. After completing my year's clinical training, I was able to obtain full registrations, but I found it difficult to get an SHO post in my chosen specialty. Pediatrics as hospital now have to demonstrate there isn't a suitable candidate from the EEA. Once I've completed my second foundation years, I should obtain a CCT, which will allow me to proceed to a special registration with the GMC, an important step on the road to becoming a pediatrics consultant. Thank you.